Welcome back. When it comes to your health, men and women can often face different challenges for common illnesses or conditions. Today we are discussing some of those differences. Dr. Douglas Kunzweiler and Erin Kunzweiler are still with us to talk about them, so thanks for sticking around, you two. So Dr. Kunzweiler, we talked about heart disease, and as you know, that's the number one leading cause of death in the United States. The second one is cancer. Is one gender more susceptible to cancer than the other?
No, I think people of all ages, people of both genders can be stricken with cancer. Tends to be more common the older you get.
Okay. Are there common types of cancer that impact men?
Yeah, prostate cancer is the leading cancer in men. Lung cancer is number 2, but lung cancer is the leading killer of cancer deaths in men. And then colorectal cancer or colon cancer is also very common in men.
Okay. And Erin, how about common types of cancer among women?
So breast cancer, lung cancer, and colorectal cancer are going to be the 3 most common in women. Just to add into that, though, there is cervical cancer too, and we do have screening for that with Pap smears. So I think that's important to mention as a preventative measure.
Okay, great, thank you. So you both mentioned lung and colorectal cancer that has an impact on both genders. Can you tell us things we can do to help lower our risk for those? Let's maybe start with lung cancer.
Yeah, far and away the most important thing is to stop smoking, stop your exposure to smoke if you're around secondhand smoke. Some of them are related to work-related things like exposure to asbestos, but far and away smoking, use of tobacco products of any kind are the most important.
Okay, and then what about colorectal or colon cancer? Are there things we can do to avoid the risks there?
I think screening is important, knowing your personal risks with family history, because if you do have a first-degree relative with colorectal cancer, screening should start earlier than the recommended age for 50. So knowing your risk factors, alcohol use also, we talk about smoking a lot, but alcohol is linked with cancers also.
Okay. Okay, so I think we've all heard that smoke and tobacco are bad for you. What exactly is the tie-in with alcohol and cancer? Do you know that?
It's clear from studies that alcohol is associated with higher incidence of many different types of cancer. And there are some very recent studies that show that it really doesn't matter much what degree or how much alcohol you drink. Even moderate consumption can be associated with higher rates of cancers.
Oh, okay. So let's go back and talk then about the cancer specific to men or women. Erin, can you talk a little bit about risk factors that make women more, I guess, a better candidate, for lack of a better term, for breast cancer?
Yeah, for breast cancer. So there's a number of risk factors. Early menarche, or when you started menstruating, so before the age of 12, or late menopause, and this has to do with your exposure to estrogen. Not having any pregnancies or having pregnancies later in life. Certainly family history and genetics, smoking, alcohol use. There's not that having dense breasts is a risk factor, but knowing if you have dense breasts, they can make mammograms a little more difficult to read. So. Again, back to, I think it's important knowing your risks and seeing your family provider on a regular, yearly basis is important. And I cover all the risk factors.
Yeah, you got all the big ones.
Yeah.
So a lot of those risk factors are very specific to women, but men can get breast cancer too, right?
They can, and they typically present with a lump. And so it's not really different so much as far as the presentation with women. Men tend to put things off in regards to their health care more than women. Sure. So a lot of times they're presenting at a later stage, sometimes with bloody nipple discharge. But
Okay.
Do you have anything to add to that?
Well, it's not very
Men-
common, so I
it's
think
not
men
very
don't
common.
think about it.
Sure.
But if they have a lump that is new, they should have that investigated.
Okay. Well, and then let's keep talking about men. The number one cancer in men is prostate cancer. What are some of the common risks there that men should be aware of?
The main one is genetics. If there's a family history of prostate cancer, then there's more chance that you would suffer from that. And we know that African American males have a higher incidence of prostate cancer than the rest of the population. So if you have a family history, then you should see your physician and get screened early.
Okay. And so those are risk factors that, they can't do much about. It's their genetics. So any advice that you would make sure you would want men to know?
If you have symptoms, especially if you're having trouble emptying your bladder, then you should see your provider. And again, as with all the other cancers, we talked about smoking and alcohol are risk factors that are controllable.
Okay. And is that the main symptom for prostate cancer then, having trouble?
Yes.
Okay.
Yes.
All right, great. Anything else just in general for men or women that they should know about when it comes to helping prevent their chances of getting cancer?
Genetics plays a role, but I think we have to remember that our lifestyle choices are really important, and sometimes can overpower the genetic part of it too. So all the things that we talked about as far as managing our risk factors, smoking, alcohol, physical activity,
Your
healthy
diet.
dietary choices are important.
Okay, great. Anything to add there, Dr. Kunzweiler?
No, she covered
Okay,
everything.
perfect. All right, well, that's great because we need to take another break. But what are some of the other differences when it comes to men and women's health? We still have a lot more to talk about. Don't go away. We'll be right back after these messages.